Hi guys, this is my first presentation on virology. I prepared it during my studies and extrapolated the information from my notes just to make the subject easier to digest. Today, I'd like to take a moment to discuss the human immunodeficiency virus and the autoimmune deficiency syndrome, a disorder with a quite interesting history. HIV, as it stands for its English acronym, belongs to the retrovirus family, a group of viruses whose main distinctive feature is an enzyme known as reverse transcriptase, pictured on this slide. Retroviruses incorporate their DNA into the DNA of the host cells they penetrate. They do so by first synthesizing a DNA copy from their RNA, which then is assimilated by the genome of the host cell. HIV then exploits the cell's molecular machinery to replicate its parts and assemble new copies of itself. This pathogen actually migrated, for lack of a better word, from chimpanzees, in which they were previously termed the simian immunodeficiency virus, to humans more than 80 years ago. And we will be going over AIDS epidemiological history next, so no worries about that. The virus is transmitted from one patient to another via sexual contact or contact with bodily fluids, including but not limited to blood and breast milk. Unfortunately, though, it may also be inherited by the baby of a sick mother during childbirth, thus having the potential of a congenital disease of sorts. Through AIDS alone, HIV is responsible for 40 million deaths. The history of AIDS and how it came to be can be traced back all the way to Africa. To be precise, the epidemic began in Cameroon, quite close to the Republic of Congo. The virus had been moving under the radar much earlier than the first reported AIDS case. In fact, 44 years after the beginning of the epidemic, HIV made its move towards Kinshasa, which is the largest city of the Democratic Republic of the Congo, thus the capital. It was not until 1982 that AIDS was officially recorded as an actual disease. 3 years later, the first patient struggling with this disease had been pronounced dead, unfortunately, eventually leading to the foundation of the National AIDS Convention of South Africa in 1992. Currently, there are 3 widely approved methods to identify the presence of the human immunodeficiency virus in human patients. A doctor might prescribe a number of antibody tests, which include the enzyme-linked immunosorbent assay or ELISA, urine and saliva exams, or one or the other. The presence of antibodies in bodily fluids such as blood indicates an immune response to an invader, and therefore alerts the physician to the presence of foreign agents. Antigen scan exams, as I like to call them, are also available, and these tests place a focus on the P24 antigen, which is concurrent with HIV infection. And what is surprising is that proliferation of this antigen begins much earlier than antibody production. The third type of diagnostic exam is called nucleic acid test, or NAT. And these protocols are meant to scan for actual HIV molecules in the patient's blood and are useful as well because they report not only the presence of HIV, but also the viral load that is present on the patient, or for lack of a better word, the number of viruses in the blood sample that was taken from the patient. A patient suffering from AIDS may experience symptoms including but not limited to increased risk of tumorigenesis, which is the formation of new cancers, retinitis, which is the inflammation of the retina that can threaten vision. The symptom is also caused by cytomegalovirus or CMV infections. Encephalitis, which is the abnormal swelling of brain tissue. And meningitis, which is the inflammation of the layers that cover the brain. Finally, a particularly interesting course of treatment for this disease is HAART, or highly active antiretroviral therapy. It is basically a personalized mixture of several medications prescribed by a doctor based on parameters such as the patient's viral load, the strain of the virus, and any visible symptoms. This is a lifelong pharmacotherapy regimen that was introduced in 1996. Notice I put treatment as a question because, according to the Mayo Clinic, there's not an actual cure for HIV. Rather, treatment is based on management of the symptoms to prolong the life of the patient. And this is it! Thank you for listening to my first tutorial, guys. If you have any questions for me, feel free to comment on this video or reach out to me on my blog in the description below. Hope you have an amazing weekend wherever you are. Please stay tuned for even more content. Take care.